Open it up for questions. First will be from New York City, Dr. Jeanette Neshwa. Hi.
Good afternoon, everyone. It's great to be here today to discuss such a critical issue of facing our country. Again, my name is Jeanette Neshwa, and I'm a family and emergency medicine doctor. And I've witnessed firsthand with my patients how devastating and how horrific it is, not just for a drug for the user, but for their families as well. It can really have a detrimental impact on families and tear families apart. And I will never forget resuscitating a young teenage boy who was found unconscious by his friends. And the worst part, one of the worst parts about that experience is having to tell his family, having to tell his mom. It was heart-wrenching. And I hope and I pray that I will never have to do that again. And so I thank you, Kellyanne, all of you, and our President Trump for elevating this issue, this critical issue. It's a real issue affecting families and many Americans here in this country. And you know, what I would like to know is what message, what advice does our president have for healthcare providers who are on the front line facing this crisis?
Any of you are welcome to answer that. I know there's a real nexus between law enforcement now and healthcare providers. We hear that from law enforcement. In some jurisdictions, a fire station is 3 to 4 times more likely to respond to an overdose than a fire. So we know there's a nexus, if you'd like to respond.
Yes, there's no doubt about it. One of the ways for many decades we've analyzed how serious the drug problem is emergency room admissions. I don't think we've ever seen anything like the admissions we're seeing now, and so many of those turn out to be fatal. So I do think that connection is important. I would say to you that most of us know somebody who's also suffered in that way, has been hospitalized or homeless even, and lost their jobs, lost their families, and the grassroots communication of the danger of these drugs is the long-term solution, the best solution we can have. I really do believe that. I think it worked previously against the cocaine epidemic, and I believe it will work now and be the most successful thing. And when you can speak out like you're talking about to your community about the disaster of young lives being lost, that would be important. We were in New Hampshire not too many months ago with the governor, 9,000 high school students. 50 mothers stood before them holding large photographs of their children who had died of a drug overdose. It was a powerful thing to see, and I hope we'll all be touched by it.
Just to add, you know, we always ask for your partnership because it's through the information you provide that we can really get after the supply chain. So we need to at all times understand where it's going, where it's come from, and who it's affecting. That helps us really target, if you will, our enforcement activities. So we thank you for everything you do.
I will say that Secretary Tillerson once shared with me and a few others that he believes patients should be told more that they don't need to take all the pain medication, that part of the prescribing is pain management need not mean pain medication. I know you heard that from Secretaries Azar and Carson and especially Secretary Shulkin earlier. But it just tells you how much everyone is thinking of how intertwined the issue is for many. So we appreciate very much that question. Our next